That was melodramatic. Cinematic portrayals often misinterpret the actual medical facts. Hello, I'm Dr. Rohit M., Assistant Professor in Department of Community Medicine with Docs Debunk, here to bust some of the medical myths regarding seizures or epilepsy.
Myth 1. Put something in their mouth or they'll swallow their tongue.
That is physically impossible. The tongue is not going anywhere. It's very well and strongly attached to the body. But forcing something down to the throat that can actually break the teeth or block the airway.
Myth 2. Hold them down or they will hurt themselves.
Bad idea. You're actually increasing the risk of injury. Instead, clear all the sharp objects that are around them and let the seizure run its course.
Myth 3. All seizures look the same, shaking and convulsions.
Nope. You have a spectrum of seizures, right from staring blank to muscle twitches and a confusion state of mind. Not all seizures need to be dramatic, but all seizures need right responses.
Myth 4. Epilepsy is contagious.
Absolutely not. It is not a communicable disease. It is not caused by a virus, bacteria, fungus, protozoan. It is just a neurological condition. It doesn't spread from one person to another.
Myth 5. If a parent has epilepsy, their kid will get it.
Genetics can play a very important role in epilepsy and seizures, but 70% of the cases do not have any positive family history of seizures. So, it is not a familial epilepsy curse.
Myth 6. Put a metal object in their hand. It'll stop the seizure.
Keys, coins, knives, none of them really help in the seizures episode. Seizures aren't afraid of iron. All you can do is be with them, time the seizures, and clear the area.
Myth 7. Epilepsy means that you can't live a normal life.
Tell that to Dan Glover, Little Wayne, and Go and Julius Caesar. All of them were suffering from epilepsy, and yet they were phenomenal in their respective field. With the right amount of treatment, all the epileptic patients can lead a very full, lengthy, and healthy life.
Do's and don'ts of epilepsy.
How to actually help someone who's having a seizure? Let's concentrate on do's and don'ts. First, the do's. Point number 1, stay calm. Seriously. Point number 2, time the seizures. If it's over 5 minutes, please call for help. Point number 3, remove all the sharp objects nearby. Point number 4, please turn them towards the side to prevent choking. Point number 5, let the seizures run its course. Now let's come to the don'ts. Don't put anything into their mouth and their hands. Do not panic. Do not hold them down. The seizures usually end by itself.
When to call for help.
When do you need emergency care? Most of the seizures do not need hospitalization, but do seek for medical help if the person is having seizures for the first time, if the seizures are multiple, if the seizures are lasting more than 5 minutes, if the person has injured himself during the episode of seizures, and if the person is having any breathing difficulties, please refer to the nearest medical center.
Are all seizures the same?
But not all the seizures are the same. If you see a pregnant woman having a seizure episode, this could be a life-threatening condition called eclampsia, which is characterized by high blood pressure, which can actually put the life of the mother and the child into a grave danger. So if you do see a pregnant woman having a seizure episode, please call for medical help. For more myth-busting medical facts, please do subscribe to our page, Docs Debunk.